All in favor? Do we have a second?
I'll second.
Okay, Irene second. All in favor?
Aye.
Opposed? All right, we're going to work on our funding proposals. Understand that we are being broadcast, that you don't need to turn on your mic or yell into the mics are on. Can you hear me there? Good, okay. We don't have introductions, but I would like to do that. Irene, would you start here?
Sure. My name is Irene Zaya. I'm one of the Mental Health Board members.
Larry Murphy, also a Mental Health Board member.
Becky Tyler, Mental Health Board member.
Mike Pierce, member also.
Joan Taylor?
Corrine Ruth Sal.
Sandy Johnson.
Jessica Williams, Sarah Flagstaff. Apologies if I mess up the technology here. I know that.
And we'd like to have the folks in the audience introduce themselves. Please speak distinctly, your name and agency. Would you start, Debbie?
Debbie Genthi, Meals at Home.
Liz Gordon, North Shore Senior Center's Care Options Program.
Osa Gisalius, James B. Moran Center. Kristen Kenner, the Moran Center.
Mary Burke Peterson, Infant Welfare Society of Evanston. Colette Allen, Family Focus.
Kathy Honeywell, North Shore Senior Center.
Jordan Moore, North Shore Senior Center.
Marianne Moberly, YOU.
Yen Jose, Open Studio Process.
Megan Miller, Trilogy.
Rebecca Bassett, Trilogy.
Eric Lindstrom, Impact Behavioral Health Partners.
Kristen Johan, Impact Behavioral Health Partners.
Marion Kearns, Impact Behavioral Health Partners.
Ann Rappelt, Learning Bridge Early Education Center.
Anne Rady, Turning Point Behavioral Health Care Center. Samir Nash, Community Services.
And our observer?
Pat Lumen, Legal Women Voters Observer.
Well, thank you all for coming. We can only, I'm sorry.
Sorry, Chairman Lake. Cindy Castro, President Behavioral Health.
Thank you,
one more in the
Cindy.
back.
One more?
Ann Sycombe, Center for Independent Futures.
Okay, thank you. Especially appreciate the Cub fans coming. We can only hope there'll be many more games this season for you to watch. I regret that you're not able to see the screen, but there's nothing on it yet of interest particularly, except the funding requests that have been made. Corinne and I were the committee that worked up the proposal, and I'm going to begin by reading the criteria that we used in making our decisions. As you all know, it's been a very difficult time for us, difficult time for the city, and the amount of money to allocate was 4% less than last year. So all of the board members worked on a rating scale, which we used in considering the proposals. After intensive review of all the grant applications, we find that Evanston residents are very fortunate to have such fine programs in our community. And I thank all of the applicants for your diligent work. And we deeply regret there's not sufficient funding to meet all the appropriate requests. So here is our recommended criteria: that we reject grant requests that do not meet either city or mental health board priority criteria. We reject grant requests that receive less than majority of approval recommendations for the mental health board members or fall below the average committee score of 3.5. We fund first-time grant requests for programs that meet both priority and approval ratings with grants of $10,000 if it is assured the program will be viable at that funding level. We fund ongoing programs with requests of less than $22,000 at the full 2017 level, or $10,000, whichever is greater. And here's the hard part. We reduce funding by 4% of all 2017 awards for programs funded at amounts between $23,000 and $70,000. And we reduce funding by 10% below 2017 award for programs that receive in excess of $75,000. And here are the exceptions. We're recommending an increase of funds for Connections for the Homeless based on large numbers and great need to maintain this program for an underserved and very needy population. And we decrease funding for the Child Care Network Scholarship Program. Our current funding level cannot sustain the high levels of funding that have gone to this program, which serves a limited number of families. All right, now I'm going to read the numbers. And you board members, you have your sheets to follow here. Recommendation for Center for Independent Futures, $10,000. Child Care Network Learning Together, $33,600. Child Care Network Early Childhood Education and Family Support, $48,063. Connections for the Homeless, Outreach and Drop-In, $55,000. CJE, and that initial always eludes me, Jewish.
Council for Jewish
Thank you. Council for Jewish Elderly, Evanston Care Management Program, no funding, not approved for funding. Evanston Scholars College Readiness Program, not approved for funding. Family Focus After School Program, $33,600. Garrett Evangelical Freedom Schools, not approved for funding. Impact Behavioral Health Clinical Service, $57,600. Infant Welfare Society Teen Baby Nursery, $62,400. James Moran Center Legal and Social Services, $39,360. Learning Bridge Infant Toddler Program, $18,500. Learning Bridge Scholarship, $10,000. Meals at Home, $10,000. Metropolitan Family Service, $67,200. North Shore Senior Center Social Services, $28,800. North Shore Senior Center Pearls Care Options, $10,000. Northwest CASA Sexual Assault Prevention, $18,000. Open Studios Project Art in Action, not approved for funding. Peer Services, $88,000. $5,200. Shore Community Service, Lois Lloyd, $17,000. Shore Community Service Residential Services, $20,000. Jocelyn Center Psychiatric Services, not approved for funding. Trilogy Evanston Mental Health Care Coordinator, $28,800. Turning Point Open Access Program, $10,000. YOU Youth and Family Services, $70,250. May I have a motion to put this proposal for consideration?
So moved.
Larry and Becky. All right. Now, here's how we're going to handle this. Board members can do one of two things. You can make comments, and we appreciate your comments. We know this is not a perfect document. It's the best we could come up with. And we want to hear from you. You can make comments, discussion, or you can make a motion to change. Now, this document is on the table, and this document is up on the screen, which unfortunately our audience can't see because we're in this situation. But if you make a recommendation for some change in this funding proposal to increase funding for an agency, you pretty much also have to make a proposal to decrease or ask other board members to help you with that. But if you feel strongly about anything, this is the time to speak up. Do I have any questions or comments, or do you need a couple minutes? Sandy?
Question and a comment. First of all, does this total 736,373?
It does.
It does.
Okay, thank you. And I want to commend both of you for this hard work. I know it's very hard work to do this, and for your thoughtful presentation to the board.
Thank you, Sandy. Other comments or motions for?
I have a comment.
Go ahead, Becky.
I think I'm a little concerned that this document that we've received and the points that were addressed, that maybe should have been part of a larger meeting. It should have been all the mental health board versus just two people. Because that's a lot of different guidelines.
Would you care to speak to that, Jessica, how we're restricted?
Sure. So here's what we can say. The memo that was put forth by staff.
Speaking up, please.
Sure. The memo that was put forth by staff in the packet, providing suggestions when reviewing city funding, that was put together after we got our budget. A similar memo was provided to the Housing and Community Development Act Committee, and so we did try to provide that to the board in as timely a manner as we could.
I don't think that's what your question is. Are you talking about the memo from staff or this criteria?
No, this criteria.
Yeah.
Gotcha.
I can address.
Yes.
The two people on the committee, on the board, who agreed to take on the challenge of trying to provide put down their thing. I think that it's the opportunity now to discuss those, and I
Right.
think that's what Joan
Can make any
and Karine are asking for. And so I don't think that that's meant to be, that's saying, this is our logic, and that's what I recall being done in last year. It was like, here's what we did, this is how we arrived at it. I hope that's correct, but we can't have everyone involved in it up front. They had to make their recommendation, because if we start sharing things broadly among the whole committee, then we are violating the Open Meetings Act. So the two of them can work these out and do this and present it for discussion. So that's kind of how it works. Does that answer the question?
Yes, I think
The
so.
Open Meetings Act creates many challenges for all of us.
Well, and I appreciate your point that it's hard to be confronted with all of this now and then be told, well, here are the numbers, here are the criteria, what do you think? You know, I realize it's hard.
It is challenging.
But, on the other hand, you can make any suggestion that you would like, and the board will look at it. So this is not hard and fast. We have to start, I mean, they have to start somewhere, so.
And this is the typical process, is then the subcommittee kind of starts defining more clearly the important facts or the important standards or...
I think what we tried to do was to provide a rationale that took into account the mental health board priorities, and as well as giving meaning to the numerical rankings, because we all put a lot of time into that, 1 to 5 scale. So that's why we referred back to that in doing these amounts. And also taking into account, for example, the idea of funding programs at $10,000, even in a couple cases where the agencies didn't even ask for that much.
No, they did.
Or they did?
Yeah.
All right, but had kind of all right, you're right, everybody had asked for it, but had made do with less than that.
Right.
Under the theory that the reporting standards and the application and all of that, if you give less than $10,000, it's probably almost not even worth doing it, or becomes less time effective. So there were sort of certain philosophies we took into account, the numerical ratings, the criteria, and we're certainly open to talking about those. This was just things that occurred to us. Maybe they're things we missed. Maybe they're things we are okay for now and we'll do differently in the future. But that's sort of what this document is.
That's helpful.
I can't tell if you're stunned or in agreement.
Well, having done this, I think that you have a mountain, a mountain of information. And how the committee sorts that it's a huge task. Takes many hours, several hours, to just sort it, much less make judgments about it. And this is a transitional year. We've been talking about criteria. We've been talking about not undercutting agencies this year. We'll be ruthless next year. But, no, I'm just kidding. But basically, I think it's a very good solution. Some things I would do differently, but, I wasn't on the committee, and I appreciate your work.
Thank you, Larry. Mike, is there anything that you would like to recommend that we change at this point?
No, not specifically, no.
Well, I don't want to cut off discussion, but hearing none, shall we move on to the vote.
Has everyone had time to?
Doesn't anyone need more time?
Are we going to vote for each one?
Yes. Help me out how we should do this.
Well, why don't we just go down in the list, and that way we can just keep walking through, and then if there are any changes or anyone wants to discuss it.
Do we need a motion for each one?
Well, you can do it either way. You can literally go through and just, if there hasn't been any discussion, so we can put them all in and then just vote if people are comfortable with that.
Should I read them one more time?
Yeah, and I can put them into the allocation, I put them in the one place, we can make sure that they're gonna be right.
All right, so I'll read them one more time, and then we need a motion to approve.
Technically, we have the motion approved, we could actually just vote, because there's been no
But
discussion.
in the past, and I don't know if that's the case, certainly it's my case, there are people who recuse themselves from some,
Very good
so
point.
that.
Excellent point, you're right, we do have to do that, because anybody has to recuse themselves from any specific thing, and it's
So
probably
it's
easiest to
one
do
by
it one by one. That
So
probably
does that
make
mean
it
we
easier.
need a motion for each one?
Let's do each one, and just confirm the amounts, and then have a vote on that.
But just read the amount.
I think so, because I don't think we have to say, because it's in the motion.
Okay.
We can say we're going to vote on them one by one, I think that's a very good point. Thank you,
Center for
Sandy.
Independent Futures Supporting Individuals. How many approve?
Aye.
Say aye. Any noes?
Yes, I would say no. I think the amount is too high. I know that your rationale,
Okay.
I'm really glad you explained that, of, 10,000 being maybe the lowest that would make sense for us to give an organization. That's considerably more than what we gave them last year.
Okay. So you have the vote. Child Care Network Learning Together, 33,600. How many approve?
Aye.
Any noes? It's unanimous. Child Care Network Early Childhood Education and Family Support, 48,063. How many approve?
Aye.
Any noes? Approved. Connections for the Homeless, 55,000. How many approve?
Aye.
Any noes? Approved. Family Focus, after-school program, 33,600. How many approve?
Do we have to mention the ones that we're not funding? Do we? I think we do have to. We have to
Yes.
say
I think
the
it
board.
probably would be good to just go
Yeah.
through the ones that.
Right, even though we're proposing zero funding,
Right.
just in case anybody disagrees.
CJE, Early Childhood Education and, no, I'm sorry. CJE Evanston Care Management Program, zero funding. How many approve?
Aye.
Any noes? Evanston Scholars College Readiness, zero funding. How many approve?
Aye.
Any noes?
Me.
Okay, we have one. Family Focus After School Program, 33,600. How many approve?
Aye.
Any noes? Approved. Garrett Evangelical Freedom Schools, zero funding. How many approve? Aye. Any noes? Approved. Impact Behavioral Health Clinical Services, 57,600. How many approve?
Aye.
Any no votes?
None, no vote.
One no vote. Infant Welfare Society Teen Baby Nursery, 62,400. How many approve?
Aye.
Any no votes? Approved. James B. Moran Center, 39,360. How many approve?
Aye.
Any no votes? Approved. Learning Bridge Infant Toddler Program 18.5, how many approve?
Aye.
Any no votes? Approved. Learning Bridge Scholarship 10,000, how many approve? Aye. Any no votes? Approved. Meals at Home 10,000, how many approve?
Aye.
Any no votes?
I'm a no on that.
A
I'm a no on that as well.
2 no votes, but approved. Metropolitan Family Service, 67,200, how many approve?
Aye.
Any no votes? Approved. North Shore Senior Center Social Services, 28,800, how many approve?
Aye.
Recuse.
And 1 recuse. Any no votes? North Shore Senior Center Pearls Care Options, 10,000, how many approve?
Aye.
Recuse.
1 recuse, any no votes? Approved. Northwest CASA, 18,000, how many approve?
Aye.
Any no votes? Approved. Open Studio Project, 0 funding, how many approve?
Aye.
Any no votes? Approved. Peer Services, 88,200, how many approve?
Aye.
Any no votes? Approved. Shore Community Services, Lois Lloyd, 17,000, how many approve?
Aye.
Any no votes? Approved. Shore Community Services Residential Services, 20,000, how many approve?
Aye.
Any no votes? Approved. Jocelyn Center Psychiatric Services, 0 funding, how many approve?
Aye.
Any no votes? 1 no vote. Trilogy, 28,800, how many approve?
Aye.
Any no on that? Approved. Turning Point, Open Access Program, 10,000, how many approve?
Aye.
Any no votes? Approved. YOU, 70,250, how many approve?
Aye.
Any no votes on that? Approved. Are we done with that?
We're done, the total goes up, 736,373.
Well, thanks.
Fully allocated.
Thanks, everyone, for working on that. Now, we have public comment. Does anyone in the audience have anything to say? All right. Next item on the agenda.
Well, Joe, there is someone.
Oh, I'm sorry.
How did you decide which how did you pick?
Please come up to the podium and say who you are.
I'm Tracy. I'm a Northwestern student and I'm interning here. So how did you decide which organizations to pick for funding and which not to fund?
The city of Evanston has certain priorities in their E-plan. Am I saying that correctly?
Well, there are council priorities, and then there are additional plans like the E-plan, which is the health plan, that are all taken into account, I think, by the board.
And the mental health.
As well as their own.
And the mental health board has priorities, and they're pretty broad. But they do not include programs that are primarily educational. Right? We're more social service, mental health and social service. And whereas some of these new requests were exciting new programs in our community that are doing wonderful things with kids. They just did not meet the priorities, which tend to be more in the mental health and serving the very low income people in our community. Does anybody want to add anything to that?
No?
Does that answer your question?
Yeah, thank you.
Thank you for raising that. All right, now we're going to talk about liaison reports. We're not going to do any liaison reports tonight, but I think we all, after this hard work and this hard listening on the part of agencies and trying to figure out what you're going to do with less funding, I think we all deserve a feel-good board meeting. So I am proposing that the next board meeting, that each board member will give a liaison report which will consist of a success story. And I'll tell you where I got this idea. I attended a fundraiser for one of our agencies that we fund. And they had a very inspirational speaker. Lots of good things were said. The thing that I took home with me was the success story. And all of our agencies have some beautiful success stories. And I'm going to ask the board members, the liaisons to the agency, make contact with your agency between now and November, and come back in November with a story of a feel-good story that we can all carry with us. And I think it'll help us get a feel for in a different way for each of our agencies. Okay? Will you do that? Now, I also, in the November meeting, want to talk about and get ideas from you, so be thinking about this, of how we want to handle liaison relationships in the coming year. It's come to my attention that there's an unevenness about liaison relationships. Some of us are in touch with our agencies or get reports from them monthly, and some infrequently. And maybe we can work on being more consistent and more fair so that we hear from the agencies on a more equal basis. Like maybe 3 times a year each agency would be reported on, something like that. But think about that for the next meeting. And I guess that would cover my chair report. And we didn't have on the agenda to hear from our staff. I do want to thank Jessica and Sarah for all the good work that you put into this meeting, and many, many hours, and being so available to me. I really appreciate that. Do you have anything to say?
No, just that third quarter reports are due Friday, tomorrow, and so I will update the board on all of those reports.
It was, I just want to make one more comment, and then we can all adjourn and go watch the ballgame. On the scoring that we did, and the staff did for the administrative score, it was very gratifying that the agencies are doing a good job, both programmatically and administratively. We really do appreciate you guys. So thanks for coming, and we'll look forward to seeing you next month or when you come back. And now I ask for an adjournment.
I move, so moved.
Second.
Okay. We are adjourned.